All right, so welcome to today's webinar. We've got 1 hour together. This is being hosted by Prevention Plus Wellness, LLC. I'm Dr. Chudley Wirch, President and Founder at Prevention Plus Wellness in beautiful St. Augustine, Florida. I hope everyone's well, safe, healthy, and thanks for joining us today. We have a sold out session. Today is 1 hour we'll be spending together, and all of you will be receiving 1 hour CE or CEU certificate for your time with us today. I'm also recording today's session, so at the end of today, all of you who've registered will receive a link to this recorded session, which you're welcome to share with others. So thank you so much for joining us today for this session. This is a description of, as you can see by the title of today's webinar, SPORT, the Alcohol and Drug Prevention Plus Wellness Program. This is a single session. It's an evidence-based program. It's for youth, and it can be easily provided online as well as in person to one youth or to a group of youth. So we're going to go through all that. So in the past, when I've shown these our programs, whether it be the sport program or our marijuana or vaping or opioid PPW programs or In Shape Prevention Plus Wellness program for young adults, any of our programs, I've just shown you the manual, I've shown you the slides, I've talked about them, but I haven't given you a PDF that you could look at and share with others, the slides themselves, because I was actually showing you the actual manual and program slides. So today I've actually put together a set of webinar slides. So you will receive these that you can review if you want, and you can share with others. So that's the advantage of today's program. So there's 3 objectives for us today during this 1 hour together. We're going to explore the contents and the steps for implementing the SPORT, Alcohol and Drug Prevention Plus Wellness, or PPW program. We have a high school, middle school, and elementary school version of SPORT. And we'll be talking about those 3 programs. That's what we call SPORT programs. Secondly, we're going to examine the scripts for implementing your SPORT PPW program, as well as the PowerPoint slides that come with the program. And we're going to look at how to implement the SPORT PPW program to youth individually or in a group, as well as in person and online. Lastly, we're going to review the built-in evaluation tools and training opportunities that we offer here at Prevention Plus Wellness for you, the prevention and health providers that may use these programs, or you may already be using these programs. All right, and in the future, we'll do the same thing. We'll give overviews of all of our programs. So we're starting with sport today, then we'll probably go to vaping or marijuana PPW, opioid PPW, In Shape Prevention Plus Wellness, the Racial Justice Prevention Plus Wellness program, and then lastly, even our Sport 2 PPW program, which is our multi-session program. So here's a copy, here's an image of the fronts of our program manuals. As you can see from the left, you got the high school version, in the middle school version, and then the right, the elementary school version of the Sport, Alcohol, and Drug Prevention Plus Wellness program. So this is a very brief overview of the program for those of you that are unfamiliar with it. Sport PPW is an evidence-based program. That means it's been rigorously evaluated, controlled evaluation studies. Those results have been positive and published in various refereed scientific journals. And then, and only then, has the SPORT program been listed on a number of evidence-based registries, the now defunct NREP, Healthy Youth, Blueprints for Healthy Youth Development, a bunch of others. So we found that through the research that sport has been effective or can be effective in preventing alcohol, tobacco, and cannabis, as well as improving physical activity among youth, both general population youth and high-risk substance using youth. The SPORT PPW program targets alcohol primarily, other drugs a little bit, and physical activity and sports, breakfast and nutrition, sleep, and to a lesser extent, stress control. It's a single session program. It can be implemented in anywhere, I would say, to 45 minutes or as long as you want. It's a screening and brief intervention. Screening brief interventions are evidence-based practices. And it can be implemented and is implemented with slides. So you show your slides and you go through your script. You have your script in your manual. You have two versions of the script, one for one youth at a time. That's where it's most tailored to youth. And the second is to two or more youth or a group of youth. All Prevention Plus Wellness programs are based on a conceptual model, a marketing model that emphasizes positive images. The title of that model is the behavior image model. Sport also includes optional parent materials, which I'll show you and talk more about. You get a manual, you get a digital download of your slides and all reproducible materials. So it's a single purchase type of a program. So it can be very cost effective, even for small organizations, NGOs that don't have a lot of funding, because you purchase your program, you have your manual, you have your downloads, there's nothing else. You don't have to buy additional materials for students or for teachers, and you can implement it to dozens or hundreds or thousands of kids. The more you implement it, in fact, the less expensive it becomes per student. So it becomes very, very inexpensive over time. And now, because of the pandemic, we have built in to the script, built into the slides, and built into our online 2-hour program implementer training, we have directions, protocols for you to implement your program to youth live online. So very flexible, very brief, very powerful, and very much able to have a full public health reach all youth with this critical prevention, intervention, prevention plus wellness message. Here is the table of contents. Here are the sections or the chapters. You can see there's 8 of them. There's an introduction. There's a step-by-step directions for implementation. Section 3 is a screening survey and goal plan contract. So why is that? Why is that included? All Prevention Plus Wellness programs follow a 3-step evidence-based practices screening and brief intervention format. And I'll describe that for you in just a moment. So that's why you have your screening survey. That's why you have your goal plan. Not only are they in your manual, they're also in your digital downloads. So you can make copies of those to give to all of your youth. You've got in section 4 a script to provide your program to one youth at a time, in person or online. Section 5 is a group script to provide your group feedback to two or more youth, in person or online. 6 is all of the evaluation materials to evaluate the fidelity and effectiveness of your program. You even have a follow-up or an additional intervention in your sport programs. That's under section 7. That's the follow-up flyers. And lastly, there is now added an additional online goal plan if you want to continue to have your youth set goals. And we'll talk all about all of these things today. So let's first of all review, for those of you who have seen this, and introduce to those of you who haven't, the fact that, and I alluded to this already, this is a 3-step process for implementing sport and all other PPW programs. It's an evidence-based screening and brief intervention practice. And here are the 3 steps. Step number 1, you screen youth for their current health habits, not just substance use, in this case alcohol, because it's a sport program, but also other health habits, physical activity, breakfast, nutrition, sleep, stress control. That's designed to get young people to be aware of their health habits. That's step 1. Step 2 is you provide feedback on each of those health behaviors in that screening survey. Use positive image terms, illustrations designed to cue or trigger unconscious future images of themselves, desirable images of themselves that are very universal across young people and older people. Being fit, active, healthy, successful. This increases motivation for change. That's the feedback Step 2. Step 3 is the action piece. It's to initiate behavior change. It's goal setting and contracting. You're going to help your youth set goals, not just to avoid substance use, alcohol, and drugs, but also improve protective wellness behaviors. This is the action piece. This initiates the behavior change. And over time, this increases self-regulation skills or teaches youth how to shape their own behavior. So a 3-step process: screening, feedback, goal setting. So let's take a look at what's included in your sport prevention plus wellness program. And actually, this is very similar to any prevention plus wellness program that we might be talking about. So number 1, you'll get step-by-step implementation directions. That's in your manual. 2, you'll get a brief self-administered, sometimes called a health and fitness behavior screening survey. The screening survey is a part of the intervention: screening, feedback, goal setting. So that's what that self-assessment is. That's number 2. Number 3, you have scripts to implement your sport PPW program to youth, either individually or in a group, in person or online. And the script is designed to, as I said, provide positive image communication, talking about the benefits, particularly the self-images that result from the wellness behaviors: sports, physical activity, breakfast, nutrition, sleep, stress control, and how alcohol, drugs interfere. So there's that integration within that feedback within your script. So you read the script, it's all done for you. It's all set up for you. Very, very simple. 4, you have a set of colorful slides for the visual learner to highlight those positive image terms and to show illustrations of youth that they can relate to, models of themselves, representations of themselves. Healthy, happy young people engage in wellness behaviors for the most part. 5, you get a hard copy and an optional online version of your goal plan. So you have this flexibility. If you're implementing in person, you could use the hard copy of your goal plan. If you're implementing online, you can use the slides, which show a slide version of the goal plan, and you can complete the goal plan simply on a blank sheet of paper. So very, very simple, very adaptable to online use, implementation, or in-person implementation. 6, you get a scannable and you get an optional online pre-test and post-test. Now, this is for evaluation purposes, but it's a beautiful thing because we have a scannable, we have an online pre and post-test designed for that lesson. Before the lesson, immediately after the lesson. That eliminates any need and effort to follow up with youth. And so for the first time, this could allow some prevention and health professionals to see exactly how well they're doing with their programs for their youth or young adults that they're implementing this to. So it's a fantastic built-in tool, the scannable pre-test and post-test survey. It'll assess the fidelity of the program, how effective your program is, and provide you with information to promote your program and to improve it over time. So that pre and post-test, it's optional, but it's built in for you. And we even help you provide an analysis of those data at no cost. 7, this is all the material that comes with your program. You get an instructor's survey. This is a self-assessment. You as an instructor complete this at the end of your every implementation. And what this is a process measure. It's an assessment of the quality of the presentation you provided so you can continually improve over time. You can also get under number 8 a fidelity checklist, so you can check the fidelity of your implementation. And then 9 and 10, you get, this is a completely optional intervention. You get a letter for parents and then 4 weekly flyers that you can mail out, hand out to youth, email to parents, or post on your website and send a link to parents to view. So what is this? What is this optional parent intervention? This is designed to get parents to provide the same positive image communications that you're providing to their sons or daughters when you present your sport PPW lesson, but it's also to get the parents now to provide that same positive behavior and image communication at home. So it could reinforce what you're doing. So a lot of organizations will send these parent letters home or email them or whatever as a follow-up intervention, but it's completely up to you. One study we did of 3 of the 4 flyers found that they were effective in a controlled study to prevent alcohol and marijuana use among youth. So it's a great tool to get parents to present this very, very important communication, positive communication at home. So that's 9 and 10 completely separate. You also have under 11 a phone protocol if you want to call some parents and see if they received these flyers. You've got under number 12 a youth follow-up goal plan. It's an online goal plan. So you could send youth after your lesson, send them a link and say, next week you're to set a second or a third or a fourth weekly goal plan. Here's the link. I'll be checking on it. And so we can give you a customized link, your organization, a customized link, so you could check to make sure your youth continue the process of goal setting and learning to shape their health behaviors. We have online resources and support for all of our programs. As long as you're implementing them, we're here to support you. And let me see. Phone and email support as well. So online resources, by that I mean if you go to our website, preventionpluswellness.com, you will see that we've got, and under the heading of resources, you will see there's a whole bunch of free resources. Resources to promote your programs, resources to enhance or extend or improve your programs over time. To share what you know with other implementers. So there's a lot of lifestyle guidelines for youth, for goal setting, really good resources on our website, preventionpluswellness.com. Look under the heading of menu for resources, and then you'll scroll down and see what we're offering for free. Lastly, we do offer separately online 2-hour program implementer training. And we highly recommend that. We separated from the program materials. There's the program materials, you know, your manual and your digital download, but we also have separately a 2-hour online program implementer training, which we really recommend because that's there where we walk you through how to implement the program specifically, how to tailor to your needs. You may even want to customize the program, and we discuss all of that in that 2-hour training. Now, what are the steps for implementing and evaluating your sport or any other PPW program? Here are the steps right here. You start off, first of all, by practicing your script. I would say prior to that, you take your 2-hour online training. That's really important. And then after that training, you practice. You practice your scripts 3-4 times so they become familiar. The beauty of this script is that, again, it doesn't matter if I implement it or you or we do today or next year or next 5 years, it's going to be the same program. So it really helps to ensure fidelity, reliability program, and also cuts down on training time. So you practice your scripts 3-4 times, and then you're ready to implement it to your youth. Number 2, if you need to, we can discuss with you how to tailor your program. The easiest way to tailor it is to simply take your PowerPoint slides and to co-brand the first slide. That's easy. You can add your logo, you can add your organization's name. But beyond that, there's flexibility in also changing out some of the images and adding a little bit of extra content. We discussed all of that during our 2-hour program implementer training workshop. 3, you make copies of your materials. That's a screening survey, the goal plan. If you're going to collect pre and post tests using your scannable forms, you make copies of those before you implement your lesson. Now, it depends on if you're implementing your lesson in person or online, or some of you may be actually doing a hybrid where you're actually implementing it to a group in person and also streaming it to a sample or population online. All of that is feasible and easily done within the tools that you get with your program and the training we discussed with you. 4, before beginning the lesson, this is your opportunity to collect either your scannable pretest or your online pretest. Okay, if you collect the scannable pretest, obviously you're going to have to scan that form, but it's very easy. It's only 1 page, the pretest. The post-test is 2 pages, so we're talking about 3 pages. You scan it in any printer scanner. If you're collecting your pre and post-test with the link that we can give you a customized link, so just your organization uses it and just your youth data is separate for you. You just show the link in the chat space. You click on it, and they go to the pretest. You give them a couple of minutes to complete it, and then you launch your lesson. At the end of the lesson, you show the post-test link, instruct them to click on it, give them a couple of minutes. The data is collected. You don't even have to scan it, don't have to touch it. So it's really, really an awesome thing. So you've got a pretest, post-test, optional tools within your program. But before you start your lesson, that's the time to collect your pretest. At the end of the lesson, that's the time to collect your post-test. And number 5, you're going to present your lesson in a private, semi-private setting. You're going to implement your program. You're going to read your script. You're going to show your slides. 6, when you're done, you're going to walk your youth through that goal plan contract. You've got options to do that in a hard copy if you're in person, or with your slides if you're implementing your program virtually. 7, you're going to implement your post-test at that point. Again, pre-test, post-test optional, but still highly recommended so that you get the data you need to promote and to improve your program. Number 8, you're going to remind your participants to monitor their goals, to post their goals, and to track their goals every day in the next 7 days. It's a short-term 7-day contract, and research shows if they're successful in achieving those goals during the first 7 days, they're likely to achieve other goals in the future. 9, if you have parent flyers, you can implement this at this time. If you don't want to use the flyers, you have your script, and we highly recommend you continue to re-implement that script with your youth every 6 to 12 months. So you can continue to use that as an intervention. Let's say you got the middle school version. You can implement it 6th grade, 7th grade, 8th grade, 9th grade, etc. So you've got that, and you can continue to provide that intervention on a, annual, semi-annual, however you want to do it. 10, after you implement your lesson, you can complete your instructor survey. You, the instructor, can then self-assess yourself. By the way, if you've got a manager or supervisor, they could use it as an observational tool, and they could also assess you. But nonetheless, you can assess yourself, see how well you implemented the program, and try to implement it better the next time. You could also use under 11 your fidelity checklist to make sure you're implementing your program with fidelity. 12, you can scan your pre and post scannable surveys if you collected those, and you can send those to us, email those to us. We have a software package, and we can run an initial analysis for you. Of course, if you've collected your data online with the online link, you just ask us for it. We'll send you the raw data. We'll send you the survey monkey charts, and so you've got all the data and all the feedback on your program. And then we highly recommend you do go to our website, preventionpluswellness.com, and sign up for free email announcements, webinars, and other resources. Okay, so let's start looking at the manual. So let's start first of all, and this is a high school sport program we're going to look at. Let's start with the group script. This is the script that you're going to provide and follow when you present your lesson to a group of youth, either in person or online. So look at what it says. That's the script to the right. This is the introduction. Hello, for the next several minutes, we'll be talking about sport, exciting new fitness and health program. And together we're going to look at how to make you look better, feel better, and improve your performance in physical activity, school, and relationships. So you look at your youth or your camera if you're presenting this virtually, and you present your script with a lot of enthusiasm and passion. That's all you have to do. You practice and you implement. So the first part, after that introduction, and you can add to that if you want to, but at least you know now what's coming. The first part of the intervention is a screening survey. So if you're implementing this in person, you read now, take out your copy of the Sport PBW Health and Fitness Screen. The purpose is to determine what you're doing about your health. Answers are private. Please don't put your name on the survey. We want you to answer honestly. So that's what you do if you present, you're going to implement this in person to a group. You're going to make copies of the screening survey. You'll distribute it. Make sure everybody's got a pencil and pen. Give them a couple of minutes. It's very brief, only 5 to 7 questions. This is part of the intervention. This is the screening survey. This is where they become aware of their health habits. If you present this online, no problem. It's built within your program slide. You show the slides, and they complete this screening survey on a blank sheet of paper. Very simple for those in person and those virtual. That's the screening survey. I just wanted to show you some of the questions in the screening survey. Again, this is the Sport PBW program, high school. The first question is, what sports physical activities did you play in the last year? There's a whole list. Those are the bubbles. They can actually bubble it in if they want to. It goes on to the next page, all the way down to S, others. They could write it any other sports or physical activities, any kind of work they did, cleaning the house, mowing the lawn, shoveling the yard, whatever, giving them credit for any kind of physical activity. Second question is a question about regular physical activity, 30 minutes, 4 or 5 times a day, running, walking, swimming. Third question is a question about environmental or social influences. Friends influence you to participate in regular physical activity. Question 4 is about eating a healthy breakfast every morning. Then other questions are about sleep and alcohol use. So that's an overview of the kinds of questions that you'll see in the sport program. Differs a little bit from high school to middle school to elementary school, but you get a sense of what we're assessing and want the youth to think about, what kind of behaviors. And these are the behaviors that you're going to give them feedback on. So now, here we go. We're going to give feedback in the same order of the order that they were found in that screening survey. So the first question was sports physical activities last year. There's your script to the right. Show the slide. Ask your group members to raise their hands and respond if they've done any of these physical activities, because you want to promote the positive social norm that my peers and my friends are physically active. Very, very powerful and positive social norm. So I'm going to repeat the question. It's on a slide for you. You just show your slide. What sports and physical activities did you play in the last year? You go down the list and you'll have people raise their hand. If they're in person, they raise their hand. If you're presenting this virtually, you can have people give the thumbs up, raise their hand if you can see them, or in most of these platforms, these virtual communication platforms, Zoom or Microsoft or Google or whatever, almost all of them have some kind of a thing you can click on, a thumbs up, a hand raise. So you can see, all the youth can see all the hands that are being raised for walking, for biking, for shooting a basketball, etc. Then you continue to provide this feedback, and you're going to highlight the benefits and the positive images of that wellness behavior. The first behavior, again, sports physical activities in the last year. So they've raised their hands a lot, and now you repeat. You just say to them, good for you. This is your script. Sports physical activities, great way to get regular exercise. They are fun. Sports and physical activities, they help you look fit and strong. Those are those positive image terms. They evoke an unconscious image. They don't even know it, of themselves in the future, being fit and strong. Who doesn't want to be more fit and strong? Who doesn't want their youth to be fit and strong, healthy, successful, etc.? Feel good about yourself, give you lots of energy, and can help you do better in school. So those are the benefits in the images related to sports physical activities in the last year. There's the slide that you show. So you're seeing the content there on the left: fit and strong, fun, feel good, energy, do better in school, work. And then there's some images we want to represent those youth that you're presenting to. So that's why we show both genders, different ethnicities, different kinds of positive activities. And these can be tailored, and we discussed that during training, if you need to tailor your slides. Then the second part of the message, is you integrate how alcohol and drugs interferes with, harms, prevents, or is a barrier to achieving that wellness behavior, images, and benefits. However, an active lifestyle, alcohol don't mix. Alcohol can hurt your performance in sports, physical activities in school. It could also have a negative impact on your health and relationships with friends and family. So that's how we integrate those messages, healthy wellness behaviors with the substance use messages. There's the image you're showing. There's the, for the visual learner, the content, repeating what you're saying. As you read your script, you're going to show these slides. Other feedback topics that are discussed in sport PPW: physical activity norms, breakfast and nutrition, getting adequate sleep, and alcohol and drug use. Under the heading of alcohol and drug, there's a number of topics. Alcohol can harm your health and fitness. It can cause life problems. These are all topics that are addressed in your script and your slides. Alcohol myths: most youth do not drink, which is a critical social norm message. Choose for yourself, plan ahead now, and lastly, recommendations for increasing wellness. Increasing wellness, what are we talking about? Well, certainly we're talking about item number 5, and we present this as a slide, but also this is built into the goal setting. You want to recommend to youth that they avoid alcohol, but also other substances, tobacco, e-cigarettes, and so on, and get 8 or more hours of sleep, eat a healthy breakfast and plenty of healthy foods, especially fruits and vegetables, get regular physical activity, and even practice stress control on a daily basis. So those are the things that you're going to recommend to youth, and they're going to be able to set some goals. So within this presentation that you're providing to youth, there are built-in discussion questions, sort of like a stop and think. These are really important when you present your program in a group setting, because you want to have interaction. But also, this is really important because you want youth to continually take this content and reference it back to their own lifestyle. What types of healthy foods do you like to eat? And would you like to eat more of? You pause, you let them think about that. And then you take maybe 1 or 2 or 3 responses. That could be a verbal response, or it could be a response typed into your chat option if you're presenting virtually. Then the third step of your intervention, notice we did screening, we did feedback with the slides, now goal plan. This is the action piece. This is how we initiate the behavior change. What does the goal plan contract look like? What are the elements? Number 1, we have recommendations for wellness, as I just showed you. Number 2, we're going to have you pledge to avoid alcohol and drugs. In the next 7 days, this is a short-term goal plan. If they achieve success in 7 days, likely to achieve success in the future. 3, write a measurable, achievable wellness behavior goal to increase one of those 4 areas: physical activity, breakfast nutrition, sleep, stress control, any of those areas. They cite it, you co-sign it, that increases motivation for change. That's a really important part of this. That's why it becomes a contract. You want them to share their goals with others. Number 5, there's a daily goal monitoring log for the next 7 days. That's a new component that we've added into our goal plans. And then lastly, you're going to congratulate them. You're going to give them directions on how to post and track their behaviors for the next 7 days, how to reward themselves, and to sort of give them a little pep talk that can do this, and this can make a real difference in their lives. And so that's what you're providing at the end of that goal plan contract. Now, there are 3 options for goal plans contracts that we provide for you as the teacher, as the implementer. There's a hard copy if you implement the program in person. There's a PowerPoint slide copy if you present it online. And there's also a virtual online that you could actually give your youth a link. They could click on it, and then you could walk them through and complete a goal plan online. So you have different versions. Even beyond this, some organizations will do something a little bit different. So for example, if you're presenting this virtually, whether it's on Zoom or Microsoft or Google or whatever, doesn't matter. But let's say you wanted them to complete a copy on an actual form. Some organizations are putting our goal plan on a Google Docs, for example. And then while you go through that, they can complete it virtually. So there's options, and we discussed those during our 2-hour program implementer training. So we talked about how to implement your program, sports PBW program, to youth, high school, middle school, elementary school, in a group setting. How about individually? What's the difference between an individual script and the group script? The key difference is that when you present your sport lesson or any PPW lesson to one youth at a time, either in person or online, it's going to be customized or tailored to how they answered each of those screening survey questions. Why is that important? Because research shows that customization tailoring can improve efficacy of a program. So, but if you can't implement it one-on-one, do implement it in a group. That's the more efficient and cost-effective way. So, sort of a trade-off. So let's see. So here you've got, there's an example. It's highlighted in yellow. This is the feedback you're going to provide after you've done the screening survey to that one individual. Now you're going to provide feedback. The feedback first is on sports physical activities last year. There's directions for you in your script. As the implementer, you're going to collect the screening survey, and you're going to read one response depending on how they answered that first question. Did they get any sports physical activities last year? If they did, yes, you're going to read the yes response. Yes is highlighted in green. This is all in your manual. Green, good, go. If they said no, no physical activity last year, you'll read the no response. No is in red, higher risk, warning, stop. So that's what you do. You're going to read the yes response if they answered yes, the no response if they answered no. Let's look at the yes response. This is the highlights of the benefits of sports physical activity. I see you participated in. Then you could read some of the things they mentioned. Could be walking, biking, through baseball or softball. Good for you. Let's say they said no physical activity. I see you may not be playing any sports or physical activities. You can really improve your health and how well you feel by being more active. So notice the initial response that you give your youth individually, depending on how they answer that screening survey question, is either positive, good for you, congratulations, that's awesome, or it's neutral. This is an opportunity. It looks like you may not be doing this. This is an opportunity for you to be healthier, happier, more successful. So that's the difference. It's either positive, initial positive, or neutral response. Nothing negative. We don't want to tune anybody out from our messaging. The rest is the same. Same slides, pretty much the same feedback, highlighting the benefits and images of each of the wellness behaviors, showing how alcohol and drugs interferes with that. So you're able to use the same slides and toggle back and forth between implementing your program to a group of youth, to an individual youth, to a group of youth. Very simple. You just change the script, whether you use individual script or the group script. All right, let's talk a little bit more about evaluation. What are the materials included in your sport PBW program? You got a pre-test, post-test survey, instructor survey, and fidelity checklist, and some other things. But let's look at these. Your pre-test, post-test survey. As I said before, you get a hard copy scannable version as well as a link that we can give you a customized link for that for your organization that you can use to collect your pre and post-test immediately before the program, immediately after. That eliminates you having to follow up with youth. It measures immediate program outcomes. So you will be able to determine how you're doing with your youth, with your program. What are the measures? Under number 3, behavioral intentions of 5 substances and 4 healthy behaviors. Behavioral intentions, because you're measuring immediately pre-post and there's no follow-up. not a week later, a month later, a year later. You can't measure behavior. So you have to measure indicators of behavior. Behavioral intentions is the most highly predictive measure of future behavior. So that's why we have that. And behavioral intentions, notice we're not just measuring alcohol. 5 substances: alcohol, tobacco, e-cigarettes, marijuana, and other illegal drugs. 4 healthy habits: physical activity, nutrition, sleep, stress control. So you're measuring you're getting a sense of all the behaviors. What is the likelihood that these young people will engage in those behaviors? That's behavioral intention. Also, your pre-post test measures perceived harmfulness, susceptibility, risk. 5 substances, same 5 substances: alcohol, tobacco, e-cigarettes, marijuana, other illegal drugs. And we know that perceived harmfulness is negatively associated or inversely associated with use. So in other words, the more young people feel or perceive, let's say, marijuana is harmful to them and others, they're less likely to use it, and vice versa. So that's what you're measuring. Also, I would say under number 5, important point, pre-test and post-test measures are identical. So you'll be able to compare them. Lastly, very important, the post-test has 2 qualitative items to help inform your quantitative items. And these are essential to you getting information and actually, in the words of the youth themselves, content that will help you know that you're having a significant impact on your youth, and you can promote your program, as well as how you can improve your program in the future. The instructor survey, as I said before, should be completed at the end of every week or at the end of every time you implement your program. It's to help you, there are 7 measures to assess the quality of your presentation. For example, under number 4, one of them is a measure of enthusiasm and passion. You get a 4-point scale. 4 is the high end. So let's say you self-assess. You assess yourself on enthusiasm as a 2 or 3. There's room for improvement, and you can continue to work toward getting that enthusiasm and passion up so that you are in the highest end of that scale eventually during your presentation. And as I said, this instructor survey can be used by your manager or supervisor as an observational tool to assess you providing the lesson and then give you positive feedback. As I mentioned before, your sport PBW program, high school, middle school, elementary school, they all have a letter for parents. You could put your organization's name in the letter or logo, and then you got these 4 weekly flyers. Optional intervention. It's designed to have parents provide the same positive image communication that you're presenting to their youth in that lesson, the sport lesson, and they can be mailed, handed out, emailed, or posted on your website. Now, let me just give you, and we're coming up toward the end here, I want to give you an example of how one organization recently tailored their PowerPoint slides. And we focus on this during our training with you, but I like what they did here. And the example here is how one organization, the new ESD 101, which is out of Washington State, the good people that did this excellent work with Sarah McNew and Jaylene Path, edited or revised or altered our PowerPoint slides for their online use to make them a little bit easier for use online. This is when they present their lesson to youth virtually. And what you do is, if you want to alter your slides, you send them to us, Prevention Plus Wellness, and we review them, give you feedback, we learn from you, and oftentimes in the case, we share with others so that you could learn as well, as you're seeing here. So what they did here with this slide, I think this is something similar with the high school, middle school, and elementary school versions of their sport program. So they added this happy face, which I thought was cute. Welcome, we're happy you're here. And then some directions on the bottom. Turn on your camera so we can see you. If you're not speaking, mute yourself. And you'll need paper, pen, or pencil. So they're going to implement the screening survey and the goal plan in that fashion. They'll show the slides, and they want their kids to implement, to complete these things on a blank sheet of paper. Here's another slide from them. Welcome to Sport PBW. Your facilitator happens to be this person. Chat box reactions. So they're showing how they can react to the content, to the feedback. They've got the clapping hands, the thumbs up, the heart, the smile, all those cute little things. So they can get, have the youth participate and interact during the lesson. I thought this was really cute. So they're implementing a pre-test and a post-test to evaluate their program. So they're going to implement the pre-test before the lesson, post-test immediately after the lesson. So they're giving directions here. Complete the pre-test survey, the pre-survey in your chat box. So they're dropping the link to the pre-test survey in the chat box, and they're even incentivizing them. Enter to win the pizza gift card. Let us know when you're done by showing us the thumbs up. They click on the thumbs up on their screen, and they show this cute little slice of pizza person, which I think is awesome. And they did the same thing with the post survey. That's the same exact thing. They showed the post-test link in the chat, and they're incentivizing them by saying, hey, you could be on a list to win a gift card for pizza. What are you doing about your health? Questions 1 and 4, interactive, raise your hand. Questions 5, think about yourself. So these are the repeat of the screening survey questions in the slides. And they want feedback, perhaps, with the early slides, but they want them to answer to themselves that last question on the screening survey, which is the alcohol question. So they want to protect their confidentiality about answering that. So that's why they say, just answer that alcohol question to yourself. Question 1, what sports, physical activities you played last year? Place your favorite in the chat box. So this is how they're going to get their students to participate, and then they'll read 1 or 2 of the chat. So this is how they did this in this group in Washington State. And then sort of this is the final, at the end of the screen, at the end of the goal plan, sort of highlighting some content which we included in it, but then they said you can do it, keep trying. And what they added here was this cute little emoji on the right there with the thumbs up and the smiling face, which I thought was very, very cute. Okay, so Prevention Plus Wellness. We have training opportunities, free weekly webinars. You're already aware of them. You just go to our website, preventionpluswellness.com, drop in your email, and you'll be told about those on a weekly basis. We got the 2-hour online program implementer training, 2-hour online train the trainer, and we can do in-person training for implementers and train the trainers. Not so much now with COVID, but what we do is now what we're doing most recently is we're training trainers, and then those trainers are training other implementers in their region. New thing coming up, brand new. I think I can get this out. What we're creating, even though you can implement any sport program or any PPW program online live, we are creating a recorded on-demand version of our programs. So we see this as being giving you another way to reach your youth online. Either it could be implemented in a classroom, but it could also be sent to youth individually. And it's going to be an interactive video of sport. We're starting there, and we're starting with the high school sport. So you can see the advantages of this. We believe it can be more sustainable. We can believe it's going to be very appealing to youth. And rather than having just a stationary image, we'll have video clips of young people engaged in these wellness behaviors, nutrition, physical activity, sleep, very, very powerful images. And I think we could do that in video and have that be a very, very important tool in your toolbox. So for those of you interested in that, let us know, because we're just developing this now, and we're asking people to take a look at it and give us feedback as we create these, what we call the VPPW, or the Video Prevention Plus Wellness programs. And you can see all the benefits and all the differences there listed under 1 through 6. These are all the programs that we offer, 15 different versions. Of course, we talked about sport today, high school, middle school, elementary school. In the future, we'll walk you through the vaping program. That's our e-cigarette program, marijuana program, opioid PPW program, our In Shape alcohol PPW program, alcohol drug program for young adults, which is being implemented in college, community, and military settings. Racial justice PPW program, and our Sport 2 6-session PPW program. There's our website, preventionpluswellness.com. Go to it, click on the upper left-hand corner, those little 3 lines on top of each other. That's the menu, and look for resources, and there's free resources there. Lower right-hand comment, lower right-hand portion of your screen says message us. You click on that, and you can send us a message. So sign up, preventionpluswellness.com, drop in your email, and you'll get free announcements about our webinars and other resources. Preventionpluswellness.com, info@preventionpluswellness.com. If you want to email us, 904-472-5022. That's our phone number here in St. Augustine, Florida. All right, let me stop at this point and see what kind of questions and comments. Now's the time. We've got, 10 minutes or so roughly. Plenty of time. If you have any questions or comments, you want to share anything, if there's anything that was confusing, let me know. So I'll just see what we have in the Q&A. There's a problem in the audio. Oh my gosh, I hope not. Let's see, not heard. Thanks. So I don't know, some of you had problems with the audio. I don't know. I apologize for that. Hopefully you were able to hear me. I checked it earlier. So the good news, it's recorded, and I'll send you the recording, and you'll be able to listen to the recording. So there are problems hearing. Audio is fine here. So something's going on at some places. So I will send everybody the recording. If you had problems with your audio from your end, not a problem. You should be able to adjust that with the recorded session. I'm sorry, I don't know what's going on. Some people heard it, some people didn't hear it. So especially when we get to other countries, that seems to be an issue. The audio seems to be an issue. So, but we got it covered because I'll send you the slides. I'll send you a PDF of the slides that we looked at today. Let me stop sharing. I'll send you the slides, and I will send you a recording of this session. Any other questions? Now's your chance to ask any questions you want about the Sport PPW program. Here's a great question from Henry. Are the programs adaptable in multicultural settings? I would say, Henry, yes, they are. So, and I would say they're very flexible in that regard, depending on what you mean by, what it is that you mean by adaptation for a multicultural setting. So you, because you've got a script, because you got a PowerPoint slide, the easiest thing is for you to adjust the slides. And then when we present that to you in our online training, we talk about tailoring. And so again, some organizations have tailored those images. I would imagine images are part of the multicultural adapting that you're talking about. So let's say your group is, mostly Hispanic kids. Then what you might want to do is change out some of those images that might have, Caucasian kids or Black kids or something like that. That is very doable. If there's one group saw that the images didn't represent what their kids did in their region, that they did more outside activities, so they switched out some of the slides. So that can be done very easily. Some of the language can be altered very easily as well when you present your script. So I think very flexible, and we work with you on that. If you want to change something more dramatic than that, we can work with you on that as well. So that was a great question. Thank you very much. I appreciate that. I'm glad that answered that question for you, Henry. Any other questions? Any other comments? Now's your last chance. We've got just a couple more minutes. I'm happy to stay as long as you want. If you have any questions, any comments about the Sport Prevention Plus Wellness program, you can implement it online. You can implement it in person. Very flexible, single session intervention, but it can be expanded beyond a single session very easily. Most organizations do that by just focusing on that goal setting piece, working with youth to continue to set those multi-behavior goals, avoiding substances, also increasing their protective wellness behaviors. Okay, I don't see any more questions. Thank you guys so much. God bless you for what you do for youth, for families in your part of the world. Thank you so much for the opportunity to share a little bit about what we're doing here. If you have any questions, please reach out to us, preventionpluswellness.com. Please keep up the good work. Stay safe, stay healthy. If there's anything we could do to help you in the work that you do with youth, with families, let us know. We'd be delighted to share that with you. Thank you, guys. Bye, everyone. Have a good afternoon. Bye-bye.